All right, well, we are here at the conclusion of our edition of the Advanced Surgical course with Full Arch Masters, and I'm here with two amazing guys, Cody and Chase from Lifeguard Anesthesia. And I wanted to sit down with you two studs and talk about your experience as anesthesia providers from this course. So, Cody, what do you think about this course?
Honestly, I think it's just one of the coolest things to be involved, especially in the charity care side of the cases that we're doing, and just really changing people's lives through dental implants and mouth reconstruction. So for us, it's just kind of a passion thing that we love to be a part of, and you get to meet a lot of cool people, great teams, and so we look forward to it every year.
That's amazing. Chase, from your perspective, give us a little lowdown on how important it is to have the right type of anesthesia and the right type of anesthesia provider for these types of cases.
Yeah, I mean, everything you do is about vigilance, right? You want to make sure that not just because you can do cases, you should do the case. Right. And so making sure that your anesthesia provider is not only running the correct type of anesthesia and has the correct type of providers and equipment and supplies, but also that we answer all the questions that are unknown things about the patient, making sure we get all the clearances, and that we approve these patients ahead of time, and we appropriate the length of the surgery, the type of care to the patient's comorbidities.
Right. So maybe you can walk me through, like, what is the process like for when you look at these patients' complex medical histories? What should doctors out there who are thinking about doing these types of cases, what should they be on the lookout for? Obviously, you guys will do the examination, but what should they look for?
Yeah, I mean, patients with significant pulmonary history, cardiovascular history, those are two of the main things we look at. Obviously, blood clots, bleeding history, things like that matter surgically. We always talk to our providers about bleeding during these surgeries and getting med holds appropriated for that. But as far as our process goes, it's usually 2 weeks out. We try to get the patient packet. It's about a 12-page packet that goes through all the patient's history. If there's any cardiac history, any major history with any organs, we go after their clearances from those specific providers. And what we do is we look for risk stratification. Say they have cardiovascular disease. We're looking for not only the HPI notes, the history of present illness notes from the provider, but we're looking for the echoes, the EKGs, the stress tests. And then we're taking all that data from all those different specialists and looking at the length of the case, the type of surgery, patient age, patient weight, and then developing an anesthetic plan, whether or not we need ventilators, whether or not it should be general anesthesia versus mod-con based on all that.
It's an amazing process, and every time we go through this, I'm always thoroughly impressed with you guys' attention to detail and your dedication to safety. That's really what it comes down to. Cody, I think we talked during the week about, you guys are spreading out pretty much around the country. You're helping people in different states.
Yes, sir.
You guys are based out of Arizona.
Yes, sir.
But you're working in a bunch of different areas. Tell me about, there's different levels of anesthesia, there's different companies. What sets you guys apart, makes me as a surgeon feel so safe when you guys are here?
I think it's because we have all bodies that do what we do dedicated full-time to dental. Mm-hmm. A lot of people in the anesthesia space, especially the office-based anesthesia space, you have somebody that's like one-off, 1 day a week, 1 day a month, that they try to come into the space, and they don't really keep track of their equipment. All of our providers have dedicated kits that have backup and redundancies to everything we do. We have processes. We train every single provider that comes onto our team. Doesn't matter how many years you've had in anesthesia space. You can have 20 years, and we just had a guy join us, 20 years of anesthesia experience, and he's still 2, 3, 4 weeks if you need it. And you're with Chase or I, and you're learning how we do things, the safe way that we do things, how we set up in the office-based space. And so I think it's really what sets us apart.
Well, I agree. When you guys are here, you're fun to have in the office. You guys are extremely knowledgeable about what you do. You're professional, but you keep it light and fun. And that goes a long way to, I think, what makes you guys special.
I think to piggyback on what he said, I think what you were alluding to before, the clearance process that happens behind the scenes, a lot of services either don't do it, they pre-op the day of, or they don't get all the data that's needed, and they certainly don't. Even if they're getting data, they leave it to their individual providers maybe to get the data based on what that individual provider may want or need. Right. We quality control that internally, centrally, so that I, as the guy who originally founded the company, am still overseeing everybody that puts somebody to sleep on our team. My input, my viewpoint on that case goes into that product. That final case is having somebody with years of experience that's done dental say, hey, this is how we should plan this case appropriately. And again, not just based on what's safe for the patient, but also perspective of how do we protect our dentist? Right. How do we protect him from the perspective of the dental board? Because, hey, we can do 8-hour cases, but is it always appropriate? Or, just different perspectives like that of, is the dental board going to look at this and say, hey, we want to take your license because of something we're doing? And we're protecting that aspect too.
Right. So if, a dentist is interested in getting into full arch dentistry and they have cases that they want to try, with Lifeguard Anesthesia, what is the best, most appropriate way that they should reach out to you guys?
Yeah, you can reach out to us directly. You can always go to our website, which is lifeguardanesthesia.surgery. We have direct links there. Sharice is our practice manager. She's really all things lifeguard, so she's always the main point of contact for reaching out in new offices. And so, like I said, reach out, email, call, go to the website. All of our contact information is there.
Yeah, and so one thing I'd like to add is being a guy who loves quality control and loves vigilance, you never once made me feel like that was a problem. Like, you've always supported that whole process. Right. You want the same thing in your product, and we can tell that. Like, the streamline of how we do anesthesia is paralleled in the streamline of how you run your courses. And we want to work with people that appreciate the value and the vigilance. Right. And that's evident in the relationship.
It goes hand in hand. I mean, you guys represent what I consider to be the premier anesthesia providing service in the United States. And I consider Full Arch Masters to be the premier full arch training program in the United States. So, I mean, birds of a feather flock together, right, brother? Just briefly, so if people are watching, what states are you allowed to help doctors in? Like, do you have a list, or should they go to the website? Like, do you know off the top of your head?
A lot of it's state specific and statute. And so, and it's not necessarily the regulatory bodies that prescribe our licenses and give us our licenses. It's the dental boards.
Right.
And so they often, or even certain state statutes requiring delegations of outpatient surgery centers and things like that. So really it is state specific. I always say reach out to us. We know all the states. We have a comprehensive chart of like what the statutes are, what can and can't be done in those states. But depending on who you work with, whether it's a CRNA, a nurse anesthesiologist, a dental anesthesiologist, or a medical anesthesiologist, there's just different varying statutes across states, or just dental board regulations and rules that kind of, guide the process of what type of anesthesia and who as a surgeon can or can't even do that type of anesthesia based on their licensure.
Right. So what's your recommendation to a dentist who's doing his own sedation for some of these cases? You know me, I do some of my own sedations. I pick and choose my cases very carefully based on their medical history, the duration of the case, and patient management. And I incorporate general anesthesia and deep sedation as well. There's a lot of dentists, surgeons and general dentists who are really just cavalier kind of doing their own sedations. What's your warning to them, and your thoughts on that process? Because full arch is getting done more and more.
Yeah. I think it's hard to multitask in two very specific areas. These are big surgeries. I think the bigger the cases get, the more implants, the more difficult the case. Anything over an hour. I mean, we have oral surgeons that we work with that say, hey, an hour is the max amount of time. Or we have other sedation dentists, periodontists that say, anything over an hour, I need a team to come in and sedate this patient. Or you look at ASA classification. Obviously, ASA 3 is a complex patient, and you should probably outsource that to another provider. As always, anytime you have another provider come in your office and provide the anesthesia, you're offloading risk. And so you're carrying a lot of risk already as a surgeon and as a dentist, and then you're carrying a whole nother set of risk as the anesthesia provider. And you're just not going to do it to the same level as if you can always focus on one thing much better than you can focus on two. And, the patient's perspective, we often hear, hey, I walked out of this dentist office because he was trying to do both, and that seemed to me to be very greedy. Right. Versus this guy that's willing to pay a little bit of money and lose some revenue to have another anesthesia professional come in, because we all know that things get done better when you have a team of experts working together.
I agree. So, all right, well, you've heard from the best, and the best never rest, right? So, if you're a full arch dentist, or if you're a general dentist specialist and you're doing full arch cases with or without anesthesia, you really need to look at the patient's medical history, the patient's experience with anesthesia, your risk profile, your team experience level, and determine what level of risk and responsibility you're comfortable with handling, right? And so if you have any questions, reach out to them. Is it lifeguardanesthesia.com?
Surgery.
Lifeguardanesthesia.surgery. And talk to these guys. I mean, I have been working with both of you for 5 years plus, something like that. And we've done, I can't even tell you, a dozen of courses or so. And we've never had even close to an issue in the professional aspect or the clinical aspect. So you reach out to Lifeguard Anesthesia if you have any questions about deep sedation or general anesthesia, and be safe with your patients. And that's the take-home message: is be safe with your patients, be safe with your license, and be safe with your career. And that's really what it comes down to. So thanks for tuning in. Appreciate you guys. Let's go have celebratory dinner. And if you're interested in coming to our course in October, these guys are going to be here. We've expanded the course a little bit, so there's still a little bit of room if you want to come in and do some surgeries with us. If you want to do standard all-on-X cases, if you want to do advanced level cases with remote anchorage, if you want to do, see what it's like to be here, you can just come as an observer and watch this process. The observers learn so much while they're here. It's just unfathomable. So check us out online as well at fullarchmasters.com and sign up for the October Advanced Surgical Live Surgery course. So thanks.